Stability in total hip arthroplasty. Stability in total hip arthroplasty depends on implant consideration and soft tissue factors. In implant considerations, we have the implant design and implant position. In implant design, we have the design of the femoral component, which includes the femoral head size, femoral offset, and femoral neck shaft angle, and the design of the acetabular component, which includes elevated liner and lateralized liner. In implant position, we have position of the acetabular component, which includes anteversion, abduction, and medialization of cup, and the position of femoral component, which includes anteversion. We also have a combined anteversion, which includes anteversion of both the acetabular and femoral component. Coming to the soft tissue factors, we have to take into consideration soft tissue tension and soft tissue function. Coming to implant design, we have the design of the femoral component and the acetabular component. In femoral component, a large femoral head leads to increased stability. This is due to an increased head-neck ratio. An increased head-neck ratio allows for a greater arc of motion prior to impingement. So, in a larger head, it allows for a greater arc of motion before the femoral neck impinges against the acetabular margin compared to a smaller neck, leading to increased stability. Thus, it is advised to avoid skirts as they decrease the head-neck ratio. Also, a larger femoral head will have increased jump distance, which is the distance the head has to travel before dislocation. So here we can see in the larger head, the jump distance is higher. Coming to the femoral offset. Here we are talking about the medial or horizontal offset, which is distance between the center of femoral head and a axis of the femoral implant passing through the center of the distal part of the stem. An increased in femoral offset increases the abductor tension. This can be achieved by decreasing the femoral neck shaft angle and attaching the neck to a more medial position on the stem. Coming to the femoral neck shaft angle. A varus stem or decreased femoral neck shaft angle increases the offset and decreases the limb length. So here we can see this is the normal neck and this is the neck with the varus. So in the varus neck, the femoral offset is higher. Whereas in valgus, the opposite true. It decreases the offset and increases the limb length. This varus neck is also called as an extended offset neck. Coming to the acetabular component, we can have an elevated liner which may increase stability, like in a posterior approach, a posteriorly elevated liner may increase stability, or a lateralized liner, that is the liner is larger in size, which increases the offset and improves the abductor tension. However, a lateralized liner may have risk of acetabular loosening and is generally avoided. Coming to implant position. Here we have position of the acetabular component and that of the femoral stem. In acetabular component, we have anteversion, which is the angle formed by the acetabulum with respect to the sagittal plane. So normally the acetabulum faces forward and this is called as an anteversion, and this angle is the anteversion angle, and the target anteversion angle is around 10 to 30 degree. Next is abduction from the horizontal plane. So the acetabulum placed at an oblique angle to the horizontal plane, and this angle is the angle of abduction. The target abduction angle is 30 to 50 degree. Next is medialization of the cup. The medialization of the cup improves the offset. However, it sacrifices a little bit of the bone stock, and so nowadays generally we do not do too much of medialization of the cup to preserve the bone stock. Coming to femoral stem, we have anteversion. Anteversion is the angle formed by the neck with respect to the bicondylar axis. So the target anteversion is around 10 to 15 degree, which is similar to the native neck anteversion. When we combine the anteversion of the acetabular component and the femoral stem, we have the combined anteversion, and the target is 30 to 40 degree or 37 plus minus 7 degrees. Now, some points about anteversion. Excessive retroversion may lead to posterior dislocation, and excessive anteversion may lead to anterior dislocation. So, in posterior approach, the chances of posterior dislocation are high, so we want a little more anteversion, and in anterior approach, we want less anteversion. In abduction, an excessive abduction is called as a vertical cup, and the chances of posterior-superior dislocation are high. Whereas in case of less abduction, it is called a horizontal cup, and the chances of inferior dislocation is high in these cases. Soft tissue tension. Soft tissue tension depends on integrity of the soft tissue and restoration of offset. The main muscle is the gluteus medius muscle, which is the main abductor of the hip. Any tear in this muscle leads to altered biomechanics and a Trendelenburg gait. A restoration of offset decreases impingement, decreases the joint reaction force, and increases soft tissue tension, improving the biomechanics of the implanted hip. Some techniques to increase the offset are increasing femoral neck length, decreasing the neck shaft angle, trochanteric advancement to a more lateral and distal position, and use of a lateralized lip liner in acetabular. Coming to soft tissue function. Problems with soft tissue function may be due to pathology of the central nervous system, including stroke, myelopathy, Parkinsonism, cerebellar dysfunction, delirium, dementia, and multiple sclerosis, or of the peripheral nervous system, including spinal stenosis, radiculopathy, and peripheral neuropathy, and related to local soft tissue integrity, which includes trauma, myopathy, aging, radiation, infection, malignancy, and collagen disorders. So friends, this was a discussion on the factors affecting stability in total hip arthroplasty. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.